Thyroid disorders. The thyroid gland is an endocrine gland located in the anterior neck, and it is responsible for the production and release of the thyroid hormone. Functions of the thyroid hormone: fetal development, brain development, skeletal maturation, oxygen consumption, heat production, and free radical formation. Cardiovascular system: positive inotropic and chronotropic effects, adrenergic sensitivity, diastolic ventricular function, lower peripheral vascular resistance. Sympathetic effects: pulmonary maintain ventilatory response to hypoxia and hypercapnia, respiratory muscle regulation, hematopoietic increase EPO and erythropoiesis. Gastrointestinal tract: promote gut motility. Skeletal: stimulate bone turnover, therefore bone resorption and reduced bone formation. Neuromuscular: essential for normal development and function of the central nervous system. Lipids and carbohydrate: affects insulin sensitivity, cholesterol synthesis, and lipolysis. Endocrine: growth, puberty, cortisol, and prolactin metabolism. Disorders of the thyroid gland: reduction or increment in size of the organ or parts of the organ, reduction or increment in function, thyroid masses and enlargement. Hyperthyroidism causes Graves' disease, toxic adenoma, toxic multinodular goiter. Hyperthyroidism presents with an increased metabolic rate. Cardiovascular symptoms include tachycardia, high output heart failure, angina, and a widened pulse pressure. Psychologically, patients may experience insomnia and anxiety. Neurologically, you might see tremor, hyperreflexia, muscle wasting, proximal muscle wasting, and even chorea. Other symptoms can include osteoporosis, hypercoagulopathy, gynecomastia, oligo or amenorrhea, hypercalcemia, and elevated testosterone levels. Management of hyperthyroidism typically involves antithyroid drugs like methimazole and carbimazole, with treatment lasting 12 to 24 months. The majority of patients go into remission. Beta blockers are also used. Radioactive iodine therapy is often the preferred definitive treatment or used in cases of relapse after oral treatment. However, it is contraindicated in pregnancy and active eye disease. Surgery may be necessary for patients with a large goiter, those who are non-compliant to treatment, or pregnant patients. Hypothyroidism is defined as a deficiency of thyroid hormones, leading to a reduced metabolic rate. Causes of hypothyroidism can be categorized into primary and secondary causes. Primary causes include Hashimoto's thyroiditis, iatrogenic factors such as drugs and surgery, iodine deficiency, congenital issues, and infiltration conditions like amyloidosis, scleroderma, and hemochromatosis. Secondary causes, which are due to pituitary TSH deficiency, include conditions like Sheehan's syndrome, surgical interventions, and tumors. In newborn infants, hypothyroidism can present as cretinism, which leads to permanent mental retardation, bone maturation retardation, and deafness. Other symptoms include cyanosis, poor feeding, jaundice, and a hoarse cry. For children and adolescents, the presentation often includes short stature and sometimes precocious puberty. In adults, hypothyroidism can affect multiple systems. Cardiovascular symptoms may include bradycardia, myocardial swelling, and pericardial effusion. Pulmonary issues can manifest as pleural effusion and obstructive sleep apnea. Gastrointestinal symptoms often include constipation, severe fecal impaction, and ileus. Renal function may be impaired, leading to decreased glomerular filtration rate and an inability to excrete water. Central nervous system symptoms can include forgetfulness, myxedema madness, absent ankle reflexes, and carpal tunnel syndrome. Reproductive issues may involve infertility, decreased libido, and erectile dysfunction. Dermatological symptoms often include myxedema, alopecia, dry skin, and carotenemia. The treatment for hypothyroidism involves replacing the deficient thyroid hormone with levothyroxine,